everyone, welcome to my channel. My name is Paige and my husband and I are on our very first IVF cycle, and before we started this I watched quite a few of these medication hauls just to kind of help prepare myself to try and see what to expect. So now that my big box of medication has arrived, I wanted to share with you and hopefully this will help one of you out there. So alright, let's start with all of the pills I'll be taking. I got 4 of them here. Alright, so I'll go through each one and kind of what each medication is for. So first pill I have is Medrol, and I have 4 milligrams, and I'll take 1 pill 4 times a day for 4 days. And let me see what this one is again. Oh, okay, yeah. This is a steroid to help reduce inflammation and suppress your immune system slightly, so that come transfer day, that your body doesn't try to attack the embryo thinking that it's like something harmful and needs to get it out. So that's what that's for, so that's important. Let's see, next up is Estrace, and it's 2 milligrams, and I take 1 tablet twice a day for 30 days. And Estrace is estrogen, and estrogen is really important because that's what helps build up your uterine lining, and you want it to be really thick for implantation and pregnancy, so that's why I'll be taking estrogen. Next pill, or I don't know if it's technically a pill, but it's a progesterone suppository, so I just have 1 of these, and I'll take this the day of transfer because progesterone is super important for keeping a pregnancy viable. And then last pill I have here, this is doxycycline. It's 100 milligrams. I take 1 tablet twice a day for 5 days, and this is an antibiotic, and this is for helping prevent infection because it's hard to keep a pregnancy so early if you're sick, and so especially since I will be having surgery for the egg retrieval, and your chances of getting infection go up when you have surgery, so that's why I have that. Alright, next, this one's kind of hard to show, but this is Menopur. So 2 vials is 1 dose because you have to mix it yourself. And so Menopur is one of the stimulating hormones or injections. So this is a subcutaneous injection, so it's just in your belly fat, and it's a really small needle that I'll use. And so like I said, that helps stimulate the ovaries to reduce the follicles. And then along with the Menopur is Gonal-F. This is also a stimulating drug. And this one is cool because it comes in like a big pen where the medication is already mixed for you. So in 1 pen is 900 IUs, and then that'll last me about 3 days or so. And then you just put on a different needle each dose, and then there's like a little dial on the pen so you can dial it to the exact dose that your doctor recommends. So that's cool that it comes like that. And then same with the Menopur, it's subcutaneous, so it's just in your belly fat, small little needle. Next up is Cetrotide, and this is 0.25 milligrams. And I have 6 of these. And Cetrotide is what I will start taking after I start the stimulating drugs, because Cetrotide will prevent me from ovulating on my own, because you don't want to ovulate all the follicles and eggs that you just produced, because then you won't have anything come egg retrieval day. So what I should say is that you don't want to ovulate before egg retrieval day. So that's why I have Cetrotide. And then the next 2 are for when I do want to ovulate. So first up I have Lupron, and I'm using Lupron as a trigger for ovulation, but I'm pretty sure that a lot of women use Lupron as one of the stimulating drugs. So I thought that was a little, I don't know, I've never heard of it as a trigger. But I will take 2 injections of this before egg retrieval to help me ovulate. And then they did prescribe Pregnol in case they see on the lab work and ultrasound leading up to egg retrieval that they think for whatever reason Lupron alone won't be enough to help me ovulate. Then I will do both. I'm really hoping I can just do Lupron because Lupron is subcutaneous, so a lot smaller needle, less painful. Although I think it's Lupron that they said sometimes burns. That might be Menopur. I can't remember. But anyways, the Pregnol is an intramuscular injection, so it's a lot bigger needle, a little more painful, so hopefully I can just use Lupron. And then last one. There's a lot here, but that went quick. All right, last one is progesterone, 500 milligrams, and this will last me, I think, 5 days. I think I take 100 milligrams a day. This one is intramuscular, so it's like a giant needle in the booty. Not fun. But I will take this from day after transfer all the way through the first trimester. So that's a long time for this big of a shot, but as I mentioned before with the suppository, progesterone is one of the most important hormones for sustaining a pregnancy. So that's why I will be on that. So that's all the medications for like the actual IVF cycle. I'm kind of in the pre-IVF cycle, if you will. So I start all of this in about a week and a half. And right now, for the last week or so, I've been on Justin, which is kind of like a birth control, but I only take it for 2 weeks. And that's to kind of make my ovaries quiet, down-regulate everything, so that then we can time when to start stimulating, and then my body will kind of kick it into overdrive. So that's all my medications. And I just want to say that although I did watch a lot of these videos to try and prepare myself, it was still really overwhelming to see all of this show up. Like, that's a lot of medications. And so I just want to say, don't be surprised if when your box shows up and you get really overwhelmed. You're not alone in this. There's so many other women out there going through this. So reach out to someone if you feel like you need to, and just know that whatever emotions come up, they're totally normal. A lot of other women are feeling them. And one other really important tip that I have for the Cetrotide and the Gonal-F, these are made by EMD. And EMD has this amazing program called the Compassionate Care Program. And you can just Google EMD Compassionate Care Program and it'll come up. And what it is they offer 25%, 50%, and 75% off their medication prices. So it was like a 5-minute form or so that I had to fill out, just some background information, and then proof of income. So I just uploaded my tax return and that was all they needed. And they offered us 50% off. So our insurance doesn't cover any of this. So out of pocket, all of these medications would have cost about $3,500. And then with the EMD Compassionate Care Program, it only cost about $2,200. I shouldn't really say only because that's still a lot of money, but it did save us over $1,000. So that was really, really awesome. So definitely look into that. But with that, that's all I got. So I hope that your journey is a success and just keep pushing on. Bye.